Hello and welcome to another episode of the Empowered Hormones podcast. I'm your host, Sheridan Decker, and this episode is sponsored by my Root Cause program. So if you guys haven't heard about that one before, jump to the link in my bio on my Instagram, have a little watch of the video and send me a DM if you have any questions about it. Now, today I have the privilege of chatting to Chloe Sheenan. Am I saying that right?
Yep, you are.
Awesome. Chloe practices in Newcastle, so New South Wales, Australia, for those that are overseas, at the Hormone Health Studio. So she's a special interest in female health and has focused her practice on empowering, educating young girls and women on the importance of their bodies, particularly the menstrual cycle and the complex interplay of hormones from puberty through to peri-menopause. So that whole range for us. We'll jump into it today, but Chloe's, after feeling like her body was trying to communicate with her in another language, which I know so many of you can resonate with, Chloe decided to enroll in Bachelor of Health Science to understand better what was going on with her symptoms. Now a university qualified naturopath, health educator, and self-confessed hormone whisperer. I love that. Chloe helps supports people to understand, overcome their health concerns, and ultimately reach a state of balance, which I can first-handedly say she's amazing at what she does because I have semi-worked with Chloe before and she is brilliant. So thank you so much for being here today.
What an intro. Thank you.
I know. I'm like, I can applaud and at the end.
Yeah.
No, thanks for jumping on. You're obviously very passionate about what you do, and you probably got a bit of a health story behind why you went down this field as well.
Yeah, and I think like when I was young, I had always questioned why, especially about health. I remember sort of questioning, why some people got warts and other people didn't. And then, all those like little interesting things, I didn't just accept, okay, that's the reason, it's sort of one answer thing. I wanted to delve into it more. And then my family, like my sister, she was going through some health issues when she was young, and my mum went and saw a naturopath. And I guess it just sort of sticks in the back of your mind. And then, you finish school, and like most people, you probably have no idea what you want to do. And then it's sort of, I realized, okay, this is the pathway that I wanted to go down, especially because I was experiencing some of my own sort of hormonal symptoms.
Yeah. And what, if you don't mind asking, what were some of those symptoms that you really struggled with?
Yeah, so I noticed that I went on the pill, well, late teens, and throughout going on that pill, it's almost like you just accept the pill that you're on. And I was sort of experiencing hair thinning, still breakouts. I thought I'd come off it. I was experiencing recurrent vaginal infections, experienced post-pill PCOS diagnosis. It was ever changing. And I just got so curious about it. And I guess that was all sort of happening whilst I was in maybe my first and second year of uni. And so you are your best sort of test bunny, really, to sort of say, okay, what's going on, and experiencing these symptoms firsthand.
Yeah, for sure. And then that kind of led you, I guess, down this pathway, and then eventually to, I guess, start your own studio and sort of the hormone studio, make those changes with people.
Yeah, so I started practicing at the start of the pandemic. Yay. So that was interesting. You've really just got to make your own way. And I think especially in our industry, it's really up to you to sort of put in that drive, put in that energy, and portray what you want and generate those clients. I always had an interest in pediatric nutrition because prior to working as a naturopath, I was a disability carer and saw the firsthand impacts of medications on children with nutrition, with epilepsy, autism, on the spectrum. So that was sort of my passion. But I guess you just sort of fall into, when you first started, you don't choose your clients, they just come to you, and then that's sort of your niche.
Yeah, for sure. And now your real niche is, I guess, that hormonal health
Yeah.
aspect and, focusing and seeing those changes. And like you said, from pubescent all the way through to perimenopause.
Yeah, so the clinic that I work at, Hormone Health Studio, it is owned and run by Georgia Hartman. I went to uni with her, and when I moved up to Newcastle as she was opening the clinic, there was just that opportunity for me to start. And it was just so serendipitous how well it worked. And we love what we do, and we're so passionate about getting this clinic, especially this face-to-face clinic, really sort of happening. And the clientele that we see is, even young people going through puberty up until menopause.
Yeah, for sure, for sure. And today we are going to chat about laparoscopy. I'm going to try and get my tongue around that again. Laparoscopy,
Laparoscopy, yes.
laparoscopies,
Yeah.
and recovering from that. And I guess it's an interesting topic because I see it in clinic all the time with women. So, so many women have got endo or recovering from surgery or about to go into surgery, all those sides of things. But I think also you've got firsthand personal experience with it as well, I believe.
Yeah, so I have always suffered painful periods. I'd take time off school. I would experience that sort of first day really bad period pain. Some cycles are 10 out of 10 pain. It's usually not very responsive, very influenced by impacts, external impacts and also health impacts as well. And so 2022 was really my investigative year. I unfortunately suffered 2 early pregnancy losses, and I was just going through some other sort of investigations around pelvic pain and health. And eventually, my surgeon at the time, or my fertility specialist, recommended that laparoscopy would be the next thing to do. And it just sort of seems, you're following that. Okay, what's next? And then you just end up going in for surgery. And so, yeah, and as like you as well, I have a lot of clients who have gone through laparoscopy, recovered from that, had diagnoses. So I feel now, having that own lived experience, it gives me sort of that next level to be able to support my clients.
And if you don't mind me asking, what stage endo were you? Like, how severe was your surgery and things?
Well, this is the thing that when you go in for surgery, you don't know what you're going to find. It's almost like a jack in the box. You're going in, and the whole point of it is because you can't see deeper than there. And so my surgeon came over to me and he put his hand on my shoulder post surgery and was like, okay, good news and bad news, you don't have endo. And the bad news of that is the fact that everybody wants a reason. Everyone wants a cause and a reason so that they can then fix it. And so in my mind, I almost convinced myself that I would have had endo or some sort of inflammatory condition. So it threw me into a bit of a headspin, because it's almost like, of course, nobody wants endo, but when you're at that stage of saying, well, at least I know if I have it, I know which pathway to go down. I can fit into the community of endo warriors. It gives you almost that sort of second identity. And so now I'm still in that same position, financially worse off, recovering, and I don't have any further explanation or diagnoses.
Yeah. And your symptoms were pretty classically endo, like heavy, painful period stuff. Like, is that?
Yeah.
Yeah.
Not really heavy periods, but it's more just the pain. That's managed well by over-the-counter pain medication and supplements, herbal medicine, but still there. And so that's enough to warrant investigation.
It's interesting, isn't it? Because like my best friend and cousin, I had her on the podcast a week or two ago, episode 99 for anyone listening. And we chatted about her endo, and she had endo and adenomyosis.
Yes.
So she had both of them, and hers was so severe. Like she was just riddled with it in a sense, and just that debilitating pain, that heavy blood loss, that bleeding and all that stuff. And it's just really interesting because some people, have stories like yours, and I hear both ends where it's like they don't have anything particularly. I've had a couple friends like that, and then others who are just like riddled with it. Or, I had someone the other day, it was attached to their bowel, and they need now I get a bowel surgeon in there when they're doing it next time. And like, there's just so much going on there.
And the complexity of endometriosis and adenomyosis is that you can have stage 4 endo and minimal pain symptoms, or you can, like me, have no endo and have 10 out of 10 pain. And that's why it really requires that additional approach, and I unfortunately fell victim of that, just being maybe like cognitive dissonance of, oh yeah, my clients all have this, I'm surrounded by it, all are bloating, this and that, I've got it, I've definitely got it, not a problem, but I don't. And so you have to open your mind up to saying, okay, you can't just it's not black and white here.
Yeah, yeah. And for those who are listening, maybe you can touch on what actually laparoscopy surgery is, because I'm assuming there's maybe people who are going, actually, I haven't heard of that before, or I've got these heavy, painful periods. I didn't know surgery was an option.
Yes, it's a lot of technical terms, but I'll explain what they mean. But before, like, I do sort of discuss the topics surrounding this, and just sort of general surgery, I just want to make a point of saying that this information is more general, and does not sort of override what surgeons sort of say. And yeah, so really what I had was the investigative laparoscopy, which means that it is keyhole surgery, similar for if you were going in to get your gallbladder removed. Laparoscopies, especially gynecological ones, are used sort of in the diagnosis of pelvic pain, such as endo, adeno, sterilization, polyps, fibroids, scar tissue removal, ectopic pregnancies, and tubal reconstructions. So they're very common. It requires a keyhole incision in the belly button. What that does then is they insert a tube that pumps your stomach up with carbon dioxide. That way you're removing your organs away from your stomach or abdominal tissue so that they get a really good view. And then depending on what you're going in for, they do either make one or several other incisions, one sort of at that typical cesarean line. And if there is sort of like endometriomas on the ovaries, then of course they'll go either side of that as well to sort of get as close as possible. My incisions are almost like a finger width wide, really super tiny. I can't even see the one in my belly button. So
then it's interesting because, like, you think of that and you go, oh, there's not a lot going on there, but you still clearly have a recovery process. And like the people I know whose recovery is taking quite a long time, they've had a lot of lesions removed. So it would vary from person to person then.
Exactly. You don't necessarily, everybody's recovery is unique. But like, of course, if you've got a couple of young kids and you can't really sort of be in bed for 3 days, or so many different reasons. But of course, what you're going in for, especially if there is that ridden endometriosis everywhere, and they are excising it, which means that they are using a scalpel to sort of dig in, which is the gold standard to remove endo, compared to ablation, which is using sort of laser removal. That's sort of more being phased out from my understanding, and excision there. It does mean more intense recovery, but you are sort of getting the roots of the endo out. I didn't have that.
Yeah, yeah. As a practitioner, is surgery around endo and things like hysterectomy and stuff, is that something that you often recommend to clients, or you err on the side of caution, or you go, you know what, I'm pretty anti it because I think there's other approaches? Where do you kind of stand on those things?
I am almost like, not the fence sitter, but I provide an unbiased opinion of positives and negatives for both things. It's almost like I question, why they say, I just want to do surgery. I say, okay, what have you done? And it's almost like I'm trying to get that out of them, definitely not giving them a yes or a no option. It really depends on their level of pain, their impact on quality of lifestyle, what they have done before, that, whether or not they've been trying for pregnancy losses as well. So, and also financially, you know, it's, if you're going private, then you're looking at around at least 4,000 up to 10,000 out of pocket.
Yeah, I've seen that. The cost of it can be crazy as well. I think that's a really good point. That's really interesting. And for those listening, if you're like, it's one of those things that it's a tool and you use it on the spectrum with everything else that you're kind of considering. And like you said, if someone comes to you and you haven't looked at, you know, or they haven't looked at diet or hormones or gut health or, you know, stress reduction or exercise or anything, then, you know, we tend to say, well, I wouldn't do that first. I would maybe book in appointments and get the ball rolling if that's the way you're going to go. But there's so many interplays with it, because you're looking at like that immune and that gut and that hormone. Like there's so many different things to consider.
And if they're coming to us and making an appointment, they're already considering an additional sort of understanding of what's going on. And so this is where we can use our knowledge and evidence based around what we know about endo, which is an ever-changing sort of condition. And just to sort of throw a little stat in here, the prevalence of endo is 1 in 9, similar to that of diabetes. However, diabetes gains so much more funding worldwide compared to a condition like endo. So eventually, when it does get more awareness and more funding, that's when we start to do more testing, more research around it, and the more we'll sort of be able to support people without surgery. There is already investigations into how to use ultrasound, a less invasive way, to diagnose endometriosis, because at the end of the day, that's what people want to know. Do I have it or don't I have it?
Yeah. How does it impact you if you know that you have it or you know that you don't have it?
So, for a client perspective, then you can sort of say, okay, we know that there's an inflammatory, potentially immuno relation here. We know that there's some stats around fertility, but then when we think about some research studies, and you're probably very aware of this study already involving N-acetylcysteine and a cohort of women in Italy, where they gave them interventions of N-acetylcysteine over a course of however long, and they got statistically significant results. Almost these people who were booked in for laparoscopies cancelled their surgeries because they had reductions in lesions as well as pain.
Yeah, it's almost like stuff like minoxidil and PCOS, you know what I mean? Like there's just these certain things that just work really well and can replace, you know, to replace metformin or whatever. But like there's just things that do tend to work really well. And then also, like you've said earlier, like your dietary stuff plays such a big role. And, you know, we know doing Dutch testing and comprehensive hormone testing just gives us so many answers around sort of what's driving that estrogen stuff as well, which is awesome. So if someone's come to you and they're thinking about getting surgery, is there certain things you can recommend for them to sort of prepare or get ready for surgery in a sense?
Yeah, so I would I just wanted to touch on as well, with the surgery of laparoscopy, it is also common for people to have a procedure called a hysteroscopy as well, which is basically a camera inside the vaginal canal through the cervix and to look at the uterus. And so really what they're doing for that as well is they're checking, because with the laparoscopy, you're only sort of seeing the external tissue of the organs, whereas going in through the cervix to have a look inside the uterus can also be an additional sort of thing there as well, to diagnose, okay, is there a reason for infertility, removal of polyps, removal of fibroids, a condition called Asherman's syndrome, which is scarring of the uterine lining. So that those two together, laparoscopy and hysteroscopy, are usually paired. You know, they want to do as much as they can while they're in there and whilst you're under GA or general anesthetic.
Yeah, that makes sense. Yeah.
And so when you mentioned, okay, what can you do to prepare for laparoscopy? First thing that I would recommend is really make sure that you've got a good understanding. If you've already had that appointment with your surgeon, know exactly what they're going to do, what you're booked in for. what happens is that we get this, I think it's called white coat syndrome. It's almost like we feel that they're inferior. We just sort of listen to them and just be like, yep, whatever you say. But at the end of the day, you are the client and it's your body that is going to go through all of this. So ask questions. As silly as you think they are, ask them again if you don't understand what they're saying. That's really important. That's probably the number one thing that I would say. And have a read through the information that they send through to you in terms of like your surgery information of what you're booked in for and the things that they're doing.
Yeah, that's really good advice, because I mean, how many times do we even just go to a doctor's appointment and we don't know something and they're like, take this or do this, and you're like, okay, all right, I guess if you say so, it's the correct thing to do. Like you're bang on there, definitely reading through and getting an understanding, and even for your own awareness and your own body as well, and going, oh, that's actually what they're doing. Because, you know, like most people aren't sort of working with this stuff every day like you and me, so they don't have that same sort of understanding of it or what they're actually doing. And even then, until you go through it, you don't look as closely into the whole thing, I suppose.
I remember just before I was about to go in for the surgery, lying on the bed, you know, in my gown, whatever, my surgeon came over and he was, you know, small talk. You're okay, Chloe? Yep. And I was like, can you do, when you go in through the hysteroscopy, can you also do a biopsy? He's like, yeah, if you want to. I was like, yeah, can we do a biopsy just to sort of check the tissue? And, you know, it's like, sometimes it's got to be that balance of, you know, understanding, yes, they're in control here, they're going to do their best job, but also having autonomy over the situation.
Yeah.
Yeah. So I guess some other things, you know, if you are, you know, if you haven't booked in for surgery yet, I would sort of consider your options around what are some other things to do if you say can't afford surgery. Seeing a naturopath, number one, seeing a pelvic floor specialist, getting acupuncture, investigating, you know, nutritional deficiencies, nutrition. There's so much. But then if you are booked in for this one as well, then yeah, that's where sort of what I'll be talking about more, and that's just because I've been through laparoscopy.
Yeah, for sure. And I guess there is all those different things to think about. And a lot of people kind of forget that. They kind of just go, oh, well, you know, I'll book my surgery and I'll be done and that'll be it as well. Like we also go, well, once I have this and I have this diagnosis, because you're going in with the mindset that you're going to have it, you're going to have a diagnosis, they're going to treat it, quote unquote. You guys can't see me, but air quotes here. And then that's going to be it and you're going to be all good. But like, you may know that's not always the case, is it? And do you know much about the recurrence of surgery, or how often we're you know, women are going back and getting surgery again?
I had a client who was young 20s who's already had 6 surgeries, and I have had some clients who have only had 1 surgery when they were around 20, and potentially now that they're reaching that sort of perimenopausal heavy bleeding sort of coming back, they're thinking about going in for a D&C, but under a different guise of laparoscopy. So it really depends on the aggressiveness of the endo.
Yeah, wow.
And whether it was ablation or whether it was excision, whether, you know, hormonal interplay as well.
Yeah, that's interesting. Yeah, because you're right. Like, I think the most complex thing is that you've got this immune component and then you've got obviously the hormone component. There's a genetic component as well, I believe. Is that correct?
Yeah, I think there has to be a genetic component, because endo has been found in young boys, endo has been found on the thumb, endo has been found in people who aren't even menstruating. So we need to sort of, there's so much about endo that we are yet to sort of understand, but there is that genetic predisposition. Yeah, and it's just a matter of, you know, the amount of hysterectomies happening, say in the sort of 80s and 90s compared to now, how many of those women were experiencing endo that was not diagnosed?
Wow. Yeah, you're right, because our technology is only just kind of advancing now in a sense. Like it's the
7-year average to diagnose, so which is still ridiculous.
Yeah, that's crazy. And to think of like the amount of women who struggle in pain with it as well. And I think of like at work and those kinds of things, or girls going home from school and all that stuff and just going, work's just period pain. And, that's quote unquote normal. And, that just happens every month. Like, I mean, I even had friends like that at school who had to go home from the pain, and you kind of like, wow, like I never experienced that onset of pain. I have PCOS symptoms instead kind of thing. But it's so debilitating. And I don't know, like you can speak firsthand from that, I'm sure.
Well, yeah, but then you do it once and then you realize you get to go home and watch Ready, Steady, Cook when you're in year 11. So it's sort of like, if I can go home with a couple of Panadol and take an afternoon off. So I think, of course, mine maybe wasn't as severe as sometimes as it could have been, but there is definitely those people who, bleed through their pants at school and
Yeah.
excruciating period pain, fainting, all the rest of it. So such a spectrum.
The things that come with blood loss like are really scary on your body as well. You're thinking of that, but then like even the fertility stuff or the pain with intercourse and those kinds of things, I guess, are also very debilitating and hard, and those sort of constant emotional struggles as well, beyond just the physical pain.
And it's the location really of the endo that predicts or an impact of fertility. 1 in 2 people with endo will struggle more to fall pregnant. So there's still 50% of people who can have stage 4 endo and conceive fine. And so I think you have to treat that individual, which is exactly what our area of work focuses on.
Yeah. So that's it's so interesting because like my cousin was talking about earlier, she had 2 sets of twins, and she's got endo and adenomyosis and a whole heap of other immune stuff going on. But it was like bam, straight away within 18 months of each other, not even that between the kids. And it was like twins again. So you just don't know. Like there's
no rules.
There's no rules at all. Post surgery, was there things that helped you? Like, you're obviously sort of going through, and any kind of surgery, I want to say, is semi-traumatic in a sense. You don't know what's going to happen. You don't know what it's going to be like after. There's so many unknowns.
It's almost like relaxed trauma because you've got that
Yeah.
blissful sort of unaware ignorance, and then it's like, whoa, what the hell happened to me?
Yeah.
I should just say as well, I have made an ebook or a handout for people, going into a lot more detail about pre-operative tips and also post-operative tips. Now, again, it's just sort of a lot of information, but you can pick and choose what's suitable for you. The only thing that I would have mentioned sort of as a surgery was, understand what you need to take to the hospital and really speak to your boss, speak to your family members and friends. And you don't know how long it's going to take for you to recover. So it's better for you to book in that 2 weeks rather than, say, oh, I'll be back to work next Monday, because you really don't know. And it can be a bit of a personal topic to talk about, but I think you need to allow yourself recovery time because you don't necessarily know what they're going to find, what they're going to remove.
Yeah, for sure.
With the post-op, a couple of big things that most people do experience post laparoscopy is going to be the gas pains. Like I mentioned before, they pump you up with the carbon dioxide, and so like I've heard my friends say after cesarean, the best way to sort of deal with these gas pains is burp, fart, burp, fart. And so however you can get that gas out, because what happens is the gas will try to remove itself out of your body, and that can be experienced as shoulder tip pain. And so not even that sort of lower abdominal pain, it's the shoulder tip pain that can be really quite painful and debilitating for people.
Wow.
Yeah. And so gas pains, nausea, which is quite common after general anesthetic, the sleepiness, some people may experience some bleeding, constipation, and pain at the incision sites. And I'll talk about those a little bit more, but one thing that I wanted to mention that maybe isn't talked about as often is your mental health symptoms that can come post-surgery. it's almost like you go in there and you may have these preconceived ideas of recovery, of diagnosis, like we were saying. And so it can be a massive journey coming out of that, and just sort of dealing with the come down of pain medication, especially for me, feeling like, as the female, why do I have to endure all of the investigations when it comes to fertility?
Mm.
There's so much to it, but I think it's okay to sort of be upset, have, down days, as long as you're allowing yourself to do so in that recovery.
Yeah, for sure. And I know, like you said, like that recovery time is so different for everyone in a sense as well. Do you feel like you were well prepared pre and post surgery? Like, is that something?
Yeah, I was probably too prepared.
Yeah,
I had, and half of the things I didn't even do. I was like, okay, I've got this heat back here, and I've got this heat back, and I've got my stewed apples and rhubarb in the fridge. I just wanted chocolate. I just wanted to watch The White Lotus.
yeah,
I just, my biggest thing for me was do not get constipated.
yeah,
I'm like a little baby. If I feel constipated, I'll
yeah.
just be sulky, grumpy, you know. And so I was eating my kiwi fruits, trying not to overdo it physically, which I probably did on the third day. But yeah,
Other than that, yeah, it's pretty. I think,
other than
yeah,
that, yeah.
the constipation is a big one. I know that in a lot of clients as well. And I'm the same with you. After having years of constipation, now if I ever get constipated, I just hate it because I know
Oh,
how good
ruins
it
my
feels
day.
not to be constipated, that I'm like, this is not normal. What is going on? And I'm like,
Yeah,
don't talk to me, don't deal with me, don't. I just need to go drink some freaking magnesium
yeah.
and eat some prunes, and then we'll be good again. Like, yeah,
Yeah,
yeah.
yeah. That's where, like, I swear I say the word euphoria like almost every day. I'm like, that's the goal once you're like almost 30. It's just
Yeah.
like nothing
Yeah.
else compares.
No, you're 100% right. And then there are some recipes in your handout as
Recipes,
well.
yes. Talking about really the recipes, what their focus is on is around protein, because protein then breaks down to support your tissue recovery, supports collagen synthesis. So making sure that you're eating good quality protein, making sure that you are having enough vitamin C, whether that be in supplementary form, whether that also be in foods like citrus fruit, kiwi fruit, orange juice, broccoli, and then fiber. So those were sort of like my three biggies: protein, fiber, and vitamin C, and of course zinc as well in there too. But a lot of my recipes that I've listed are delicious, but are also easy on the stomach, easy to digest. But I do list in there sort of specific supplements that can work fine with medication. That will be your peppermint capsules to support the bloating, and reducing sort of the gas. Vitamin C again, zinc. If you wanted to take a collagen powder, you could, but I just sort of go into the main things that if you were going to take something, those would be it.
Yeah, for sure. And then what's next? Like, if you've gone through this whole process and you've had surgery, I guess you've kind of got to go, well, you've got endo, and what are you doing with that moving forward so that you don't go back into surgery? Or like yourself going, okay, well, I don't have endo, that's ruled out. Then you're kind of starting to look at those next steps. Like, you must feel a little bit at crossroads now going, okay, well, what next?
I'm sort of that person who is almost like, cool, what do we do next? Yep. And then
Yeah.
what next? And so I've probably condensed what would be someone's maybe 3-year fertility journey into 12 months. And of course, that has its pros and cons. But I think with, my acupuncturist, my surgeon, they all just say to me, chill out, and not in a condescending way, but in a way of like, trust in your body's ability to recover. Yes, it's horrible on a physical perspective and also mental health that I have experienced losses, but also I need to trust in my body that it can do what it needs to do given the right environment, support my health with whatever that sort of looks like. But yeah, it's sort of seeing what periods are like, especially for people, their first sort of period after surgery. Hard to tell, is it a combination of influence of pain medication, general anesthetic? So I think it's almost like you've got to take it month by month, and as symptoms do arise.
Yeah. No, that's good. And then if you don't, like you touched on earlier, if you didn't want to go down that sort of medical route or didn't want to go down surgery, is working with, someone who's a bit more holistic, naturopath, nutritionist like yourself, myself, whatever, is that sort of your main other option, or what other things can you be doing?
I think the thing is that you can see it all over social media. It's almost like everyone is this endo specialist, and all you'll see is cut out gluten and dairy, which, you don't want to be dealing with pelvic pain and then also have to restrict one of life's greatest pleasures, which is croissants. And so I think it's just about understanding what works best for you, what are your triggers, and learning how to live through that. There's a lot of great upcoming evidence supporting low FODMAP, sort of like your anti-inflammatory Mediterranean style diet for endometriosis, focusing on the foods that you can eat rather than this big list of foods that you shouldn't be eating, targeted supplements, supporting pain, speaking to pelvic floor specialists, especially if there's sort of bladder or incontinence issues happening there. Like I said before, acupuncturists, but there's a lot of different ways that you can have support, and it's easy to want to do all of them, but really with what I sort of say and what we do say to our clients in the clinic, give yourself 3 months, a minimum of 3 months, with really focusing and targeting on a goal and working with somebody. After that 3 months, then sort of reconsider, is this working for me? Is it aligning with me? If not, what's the next thing? Don't just sort of dip your finger into it and try a little bit, say, nope, not for me, moving on to the next thing.
Yeah. And the biggest thing, like on that low FODMAP stuff, and obviously you guys listening know that I've got a heap of episodes on that, but in all my endo clients, they've all tested positive for SIBO. So we know from the research and the literature as well, and even just now, from firsthand experience, that so many people have a SIBO overgrowth, or for those who don't know what that is, your small intestinal bacterial overgrowth. But because, is that link there, and if there's lesions or the organs are sitting differently than they would be, like, there's just so many compounding factors there that, going on something like a low FODMAP short term definitely will reduce a lot of your symptoms while you get to the root cause of what's going on, because you're just removing all those fermentable fibers, which are just going to sit there and create that gas and constipation, loose stools. But there is that other train of thought, which I don't strongly push, but it's definitely there, about when you've got that immune system, things like gluten and dairy can really flare it up. But it's hard because I don't have any endo clients who don't have SIBO who I can then say, try gluten and dairy. Is your is your body responding to it or not? Because there's always a bacterial gut component, and until you fix that, well, you're probably going to react to those foods anyway.
And it's almost like, how much are you having of that? And we sort of say this blanketed thing of dairy, but really what does that mean for somebody? And I think a lot of it is working with somebody and breaking it down and having this understanding so that you can move that into your lifestyle.
Yeah, interesting. Well, thanks for sharing on all that endo stuff. I know that's a topic that's super close to you, so it's nice to sort of pick your brain on it. I briefly just wanted to chat to you about the vaginal microbiome, because I know you're a bit of a guru in it, and I just think it's something that, it's so complex, and it's just one of those things that just goes and goes and goes, like, where do you start, where does it end, kind of thing. But something I hear very commonly is people talk about, bacterial vaginosis or thrush or candida or, whatever it is, just symptoms. People don't usually come with a diagnosis. They usually just come with symptoms. But can you just chat on that for a little bit for us?
Yeah, so the vaginal microbiome is a really incredible space to sort of be working in terms of, there's so much more that we're getting an understanding about, especially when it comes to fertility as well. Tommy's a organisation in the UK. They had funded a really interesting study suggesting that women who experienced early miscarriage were associated with lower levels of lactobacillus species in the vaginal canal. And so as well, previously, where we thought the uterus was a sterile environment, we realized that there's now a uterine microbiome that we're working with. And that's where conditions such as endometritis, which is inflammation of the uterus, can impact fertility. So it's really fascinating and something that I do work closely with my clients with, in terms of recurrent infections, because if you get a random bout of thrush or a random bout of BV and it clears up by conventional treatment, then okay, great, you understand. Yeah. But most likely we know that, especially with BV, if you are treated with antibiotics, that 6-monthly reoccurrence is quite common. And so when I speak to my clients about the vaginal microbiome, I sort of think about it in the sense of, it's like, okay, if you are building and growing a veggie patch, you need to sort of think about the soil, what you're growing in there, the environment that it's sitting in. And the why I think about that is because that vaginal microbiome needs to be this tight, controlled environment that is very influenced by external factors, by hormones. That microbiome is largely made up by your lactobacillus species. And so with that lactobacillus species, at their end stage fermentation, they produce lactic acid, which causes that vagina to be more acidic, sitting between sort of 3.5 to 5, which is quite acidic on the pH scale. And so when you have external factors such as semen or menstrual blood, which are both either neutral or more alkalized, you can throw off that delicate microbiome balance. And so it's really about restoring it back to what it was and providing, your body to be able to do that, and working out what's the trigger here or the aggravating factor.
I didn't know that was the 6 months. Like, that's really interesting. Is that just for
Yeah.
BV then? Because like thrush, say
BV.
someone uses over-the-counter stuff. Like, I was chatting to a chick the other day who's getting it every single month. So I'm assuming the pessaries or whatever, that's not 6 months, but your what is it called?
Metronidazole?
Yeah, that's the one. Is that more of a 6-month thing for your BV?
Well, it's just that reoccurrence. Unsure why, but if you're it's a condition such as with thrush as well that can be passed back and forth with sexual partners. And so when you're speaking to that individual, yes, it is personal, but you need to ask all the questions, and saying whatever you're sort of putting in or around that area needs to be questioned.
Yeah. Yeah. Well, hey, yay, everyone. I just passed my 6 months and I had no recurrence.
Ooh, you get a certificate.
Yeah, I know. Because that would have been June, July. That was right before 3 days before I flew out to Bali, and I jumped on those antibiotics because I was
wow, is that 6 months?
stressing. Yeah, it would have been July.
Mm-hmm.
But like exactly what Chloe said, if you do the right things and you feed that microbiome, because I mean, to be fair, I was very, very diligent. This is not just I did a treatment, didn't do anything, guys. I took all her advice and, did the pessaries and did the Flurstat and took everything with me. And if you do the right thing, like you said, same with your gut, same with anything, you can rebalance that microbiome. But I think what we forget is that these things take time as well. Like feeding it or lactulose or whatever it is, it's like there's no just, okay, treat it, I'm done, like endo in the surgery,
Yeah. And just because you're growing mushrooms in the veggie patch doesn't mean that you have to throw away the whole veggie patch. You just have to reconsider what's happening and look at the environment, look at the influences there. That's a really weird analogy, but it sort of makes sense with
I get
it's fungal.
Yes, yes. And I guess it's one of those things like that. The symptoms are so debilitating in itself as well, because, if you get smell or the itchiness or the pain, like I didn't get the smell or discharge, but I just had the pain and I was like, felt like a UTI, like I felt like I was dying. But it's like, if you have these symptoms, or women who have the smell and the discharge, I remember chatting to the group of women in Bali and a lot of them got reoccurring thrush infections because they're always in gym tights and gear because they're all fitness trainers. So it was this really interesting of going, okay, well, you're in this environment where you're always sweating, you're always in tight clothes, all this stuff that you sort of put yourself at risk for it. And then you get those symptoms and that sucks and it's embarrassing and it's not a nice place to be in.
No. And so for us to have a client come to us and disclose that, we need to sort of have that gentle approach and say, this is, what is sort of going on, and give them some understanding, and just, be gentle around that whole process, because not every day people are talking about vaginal overgrowths like us.
No. And it's interesting because, like the people that you and me follow on Instagram and stuff, you see it quite regularly. And even that book you shared today, I went and followed that.
Come As You Are.
Yeah, amazing. And I went and followed her Instagram and some of her podcasts, and I was like, oh, this is so good. But it's in our thought pattern then, whereas most, generalized, most women aren't following 10, 15 different microbiome account or vaginal microbiome stuff.
That's like why people sort of be scrolling through social media. It's like, oh, fashion influencer, like matcha latte. And then there's like my post. It's like vaginal discharge, cloudy, clumpy. Like, it's just
be like,
whoa.
Wasn't expecting that. And for you guys listening who aren't following Chloe, go over to FEM_ED, so FemEd, and give her a follow, because her information is great. And also I will link in her website, which is www.femed, again, so femed.com.au, and you can find, is your free ebook that you chatted about, is that on your website yet, or are we waiting for it to go up on your website?
Waiting, but it shouldn't be.
By the time this podcast comes out, which is be a couple of weeks, it might be up. So
it will definitely be there by then.
Easy. So you guys can jump over, have a look at that. She will probably let you know on her Instagram anyway once it's on her website, because she's good like that. Give us a little reminder. It's always helpful. But thank you so much for jumping on today. I honestly think you're amazing. You're a world of knowledge, and you care to clients and you care for people, and the way you treat people and go like above and beyond for them is really humbling.
Oh, so thanks, Sheridan. It's been really good to chat.